So welcome, Dr. Feliz. This is an interview for the Health Justice Collective. Our main objective is to highlight the contributions of diverse individuals within the healthcare system who contribute to health and wellness for all Memphians and all Tennesseans, because we know that our campus spreads across the state. So just could you start off introduce yourself, your name, your title with the university, and then if you wouldn't mind just briefly describing, yourself and your organization or your roles, and that could be unofficial with the organization as well.
Sure. Well, firstly, thank you very much for having me, and it's really an honor and a privilege to speak with you on these important subjects. Well, my name is Alexander Feliz. I have a number of titles within the University of Tennessee's Health Science Center and Le Bonheur Children's Hospital. I am a pediatric surgeon at Le Bonheur Children's Hospital. I am the residency program director for the Department of Surgery. So I'm in charge of the education of young physicians who are interested in being surgeons. I also am the program director of a critical care fellowship for surgeons at Le Bonheur. I've been involved in health equity at Le Bonheur. I've started a small group of interested physicians called the Center for Health Equity at Le Bonheur. And we meet monthly and discuss issues related to patient care within the hospital and advocacy and research within Le Bonheur. And I've also been deeply involved in committees focused on diversity and inclusivity within the medical center, within the Department of Surgery, Department of Pediatrics, and also university-wide.
All right, is that it? I think you might be missing a thing or two, but
I am missing a thing or two, but that's good enough.
All right, that's the sum of it. Gotcha. Okay, well, let's just jump right into the question. So first, in your opinion, what are the most pressing health-related issues facing the communities you serve?
I think when it comes to Memphis and its surrounding communities, it's every physician in the region deals with and battles against the social determinants of health that our patients and families have to live with. So so I've been very involved with trying to help families. I've helped immigrant families get care for their patients, for their children and my patients. And then I've certainly helped in some community engagement. We've hosted community health fairs with it. Before COVID, it was yearly with a community in Whitehaven and an apartment complex there where we hosted health fairs with church groups, which really not only do we get a lot of people care, but we actually connected families and patients with the primary care providers within the community.
Great. I like that you added that last part. Sometimes it's kind of like parachute help and it's just like a one time, but to connect them to people that can continue to help and maintain that care, I think is really important.
So we've really focused on not being those parachute type of physicians and being a real partner for the long haul.
Great. What do the terms health equity and health justice mean to you? And this is a two-parter, but I'll start with that one first.
Yeah, I think, sorry, I have a dog. Sorry. Would you state the question again?
What do the terms health equity and health justice mean to you?
I think they're rather synonymous because achieving health equity, which is that everyone in our society and the world receives, uh, has the right to good health and receives strong care to achieve that good health. That coincides with justice and social justice. We cannot achieve equity without um, having a true moral obligation to all of our patients, which deeply involves justice. So they're two separate terms, but they can